This is a quick introductory video on PASS. PASS is a new resident-driven tracking and reporting system by Orthobullets. The goals of PASS are very simple: to improve the quality of physician training and decrease the cost of physician training, and to do this on a global level. More specifically, we have created a new system to generate ACGME milestone reports. Using this system, ACGME medical knowledge levels, patient care levels, and professionalism levels are generated using a modern-day, data-driven learning management system. The advantage to the residents is that these levels are based on objective and transparent data. The advantage to the departments is that the ACGME reports can be generated very cost-effectively, and the PASS learning management system can become a very valuable tool to improve physician training. The way we do this is by taking the basic principles of education and applying them to physician training. You move to a structured competency-based curriculum, performance data is collected on well-defined interval goals, and progress is measured with real-time tracking systems. The key to do this is data. Just like we rely on clinical data for our clinical studies, we need to rely on educational data to make education more effective. The data must be objective, transparent, and real-time. Historically, medical knowledge has been determined by faculty evaluations, but we all know how difficult that can be. Oftentimes, the faculty evaluations are not done. It consumes a lot of resources to get the faculty to fill out the evaluations, and then when they do it, oftentimes they just give all the residents 5s. A recent study in the Journal of Graduate Medical Education showed there was no significant correlation between medical knowledge as assessed by faculty evaluations and in-training scores. So what we do is different. We determine medical knowledge levels through an annual testing platform. Residents have an annual core curriculum. It's combined with an interval testing schedule, and that way residents can track their own progress. They can identify their strengths and weaknesses so they can address areas of improvement. Program directors can keep an eye on all the residents, making sure they're tracking appropriately. And then what we did is created a classification system which was aligned with the ACGME milestones. So we analyzed the ACGME milestones and then assigned ACGME levels to all of our questions in our QBank. What that means is we can break down a resident's percentage score into an actual ACGME level. Let's look at this example of diaphyseal femur and tibia fractures. This resident has an ACGME level of 2, as you can see over here on the right. Now if you click this icon, you can see the way that level was generated is he has scored 100% on 6 level 1 questions, 75% on 8 level 2 questions, but he has not met satisfactory grade for level 3, 4, and 5. That means he is a level 2 for this milestone. Compare that to ankle arthritis, where he's a level 4. If you look at the breakdown of questions, you can see he scored satisfactory on level 1, 2, 3, and 4 questions. The key here is that the data is objective and transparent. Residents have access to this data at any given time, so they know exactly what level they are. Therefore, if they're deficient, they can make efforts to make sure that they are on track with each biannual grading cycle. The goal of PASS is not to identify residents who are deficient, but instead to allow residents to identify their deficiencies during a window so they can take corrective action. That way we can all get to where we want to be, which is all residents have reached their appropriate levels every 6 months for the biannual grading cycles. The advantage to the department is they can generate resident medical knowledge levels with very little faculty resources. At the end of each 6-month grading cycle, the CCC can generate a report that shows the levels for all the residents. If any of those levels seem inaccurate, they can simply override them in the final report. For patient care, we've simply created a skill tracking and evaluation system that is mobile, user-friendly, and actually improves technical training. Once again, what we did is we looked at the ACGME milestones, and then we created our own skill tracking system. For the 48 different milestone procedures, we broke each procedure into 15 different skills. We then assigned an ACGME level to each of the different skills. So you can see here the ACGME thinks doing your preoperative H&P is a level 1, so we also created a skill which is a preoperative H&P level 1. The ACGME thinks performing your graft passage is a level 4, so we also created a skill which is graft passage, which is level 4. We added additional skills that we thought were important, such as patient positioning and preoperative templating. This is what the skill tracking system looks like on the smartphone. On the left, you see what it looks like for a resident. The resident simply logs onto his smartphone and he can track his different milestone levels. You can see here for ankle fracture, he is a level 1.5. Now if the resident clicks in the top right, he can see his target competency level. This is the ACGME level he should be at every 6 months. Obviously this number increases every 6 months and he should be a level 4 when he finishes residency. So you can see here for simple bimal ankle fracture, he is a level 2.5. The resident can see that he has completed all of his level 1 skills and all of his level 2 skills, and now he is on his level 3 skills. So if this resident wanted to demonstrate that he could do his lateral malleolus lag screw and plate fixation, he would simply send this to the faculty member the night before, notifying the faculty member that he wants to demonstrate this skill. He does this by clicking on the link and sending it to the faculty member. Now the faculty member has his own smartphone application as seen on the right. When a resident sends the milestone skill evaluation to the faculty member, he will get a notification. In this situation, the faculty member will know that the resident wants to demonstrate that he can do this skill the following day. The following day in the OR, the resident will remind the faculty member that he intends to demonstrate this skill. At that point in the operation, the faculty member should stand back and let the resident demonstrate that he can do that one skill independently and competently. At the end of the case, if the faculty member feels that the resident has done that skill competently, he simply grades him and makes a comment, and he sends it to the resident. As you can see on the left, the resident gets immediate notification of his grade. The end result is that the resident has his own skill tracking system, and he can track his progress through these different skills. So you can see here for a total knee replacement, he's done all of his level 1 skills, all of his level 2 skills, and all of his level 3 skills. Therefore, he's assigned an ACGME level 3. Every 6 months, these ACGME levels go into a reporting system. Once again, the resident can track his own progress on his cell phone to make sure he's tracking appropriately. Once again, the goal here is not to identify residents who are deficient, but instead to give the resident a well-defined target so he can make sure he's approximately on target every 6 months. The advantage to this is when the CCC goes to generate their ACGME reports, all residents should be in the appropriate ballpark. If there are any residents who are outliers, the CCC can look into the objective data and override that appropriately. Our pilot programs have showed that over 90% of faculty evaluations have been completed within 12 hours due to the ease of the mobile platform. In addition, there's a milestone skill tracking dashboard so the program director can see how many skills are entered every day, which ones are graded, and which ones are not graded. Automated reminders ensure that all faculty evaluations are complete. For professionalism, we did a similar thing. We simply created a simple mobile platform where monthly professionalism evaluations can be collected, but we built it in a way so the ACGME levels are accurate. This is what it looks like for the resident on his smartphone. Each month, he requests at least 2 professionalism evaluations. One has to be a faculty member, and the other can be a resident or somebody else in the hospital. Here's an example of a resident submitting his monthly professionalism evaluation to a faculty member. He simply submits the request. On the right is what it looks like for the faculty member. He will get an email notification. Once he clicks that email notification, he will be taken directly to this page. Now what we've done here is created a guide mode that helps the faculty members understand these new ACGME levels. Because this resident is a target competency level of 2.5, you can see that his professionalism ACGME levels have been set at 2 by default. Now what happens here is the faculty member can go in and titrate up or titrate down accordingly. And you can see that he has a description of what those ACGME levels are. So what this does is it both educates the faculty members on what these different ACGME levels are and helps make sure we aggregate accurate data. At the end of the evaluation, the faculty member can make any specific comments, and then he submits the evaluation. The evaluation data then goes into professionalism reports for the individual residents, and every 6 months the CCC can use this data to generate the ACGME professionalism levels. As you can see on the left, the data is collected in the same fields that need to be submitted in the ACGME website. If any of the levels don't seem correct, the CCC once again has the ability to override these levels. So in conclusion, PASS is a modern-day, data-driven learning management system that is designed to improve the quality of physician training and decrease the costs of physician training. The mission of Orthobullets has always been to advocate for the education of residents. PASS is no exception to this. We believe that residents will benefit by having their learning objectives more clearly defined, and we hope that by using PASS, all residents will have the knowledge and skills required to practice independently at the end of their residency training. Passing the board should never be an issue. For the department, we feel like PASS offers an opportunity to significantly reduce the resources required to train physicians, especially with respect to the biannual ACGME Milestone Reports. We hope that all departments can produce their biannual reports in one meeting in 1 hour. This should represent a significant cost savings than what is currently happening, where it often takes multiple faculty members multiple hours with multiple meetings. Imagine if we could make doctors 20% better in 20% less time, and imagine if we could do this on a global level. Doctors would be trained more efficiently, those doctors would then go on to train other doctors more efficiently, and all these doctors would take better care of patients. The impact on society could be significant. That is the goals of PASS, to improve physician training on a global level, leading to better patient care and a significant impact on society.